Asi ai ngā kaula uloto Fisiri nai pea Hengi pea Ake o wha Ki umutana Kamo ono kakala Fasi moea O katama mana Wisa e mea mamai Whai loto E te ui Ui no ate e lava nai he Ma iri e mata I he whare o e ofa Si ueri mahu inga sila I e te o whatukua Si inai tingi ke e naniwi ai Koe ware anga e te o whapeta e mangalo I a kuonga Neke hange si a o ka hosi ue Te koha to mama tai a moni Te hokoko e te sia te kere si roi no fotai Ana tula e ne foto o a sini sini mo o piu O iaue Asi te tangi roto E kakala tapu ni koto saunga Sia siume koula to e Kau kau anga ia e te nofo mana Kau kau anga ia e te nofo mana Hangina ai e wakakai a whekei Lua anga e kaka I a poha Where a whea whaaki te ware a I e manatu Whelu te ni e mahene ko motu loto Puta anga e te ewa I e kina kai whoke Kau utu fia lo I naka e te ofa mai Wisa e te ofa ni pai E moana maha E se ni e katalana apa ari E no whako O iaue Asi e te kangila to e mawai E kakala kapu ni koto saunga Sia siume koula to e Kau kau ana ia e te nofo mana Kau kau ana ia e te nofo mana
Oe au no fo kai au fuato kai whakanoa loto o mana wahoko. Ko e tala noa moe o momo ki he anea fi moe anga e no fo. Ahoe au no fo kai au fuato kai whakanoa loto o mana wahoko. Iwe si oto makawhare o malua ki tupu e kere si e no foni e koe whakamaunga unua ki e whanua koe hanai e tatau koe hae te unga e koe viso ne e ni ko tu unga unga. O iau he kere si mo e ta whenga monu ko tau lou fuku vehi mohoto whereni. Pangai o e hau unua ki e whanua tupu au he lo au whai ke tupu tupu a. Ko hai e rea tupu ki pangai o malu e fia fitai tō e la a. Hopa kani watangi mo e te iko Galanga e tokanga ke tau a ki loto Ka whelu teni e o whawhio mo e merino A whei taula loa e pule alangi Ki he au no whapuri e te amanaki Si whanga o taha ho ta whakamaunga Te ulau kau aki o katoa e laka He paenga e whawhai anga e lafo Tue mamamato a lau roa taha Koe whai anga ia o e te fie tangata Koe puke a fufura ta lau tau whonu Koe kolosi mo e whukalotu koe whakamaunga
Lippy, can you hear me?
Hi, yeah.
Oh, yeah, make it up a little bit louder. Hi, Lippy.
Hi.
Oh, my God.
Nice to meet you.
Tell them, that we're doing this. Please. That's not good. You can put it after hours. What is it? Huh? I know. Can you tell them that we're doing a program? Yes. Yeah, it's kind of messed up here with the podcast. Oh, it must be. Hi, Dr. Amy. Should I'm the one that should go tell them because we're not going to just go now. But I live in a very warm area. Ako. Pero manatu ikaw kare waktu post me aya it's just like interfere. Because tau rea ko tapi ngule pick up kata mo sound go. Okay, on your schedule go your recording to do it all then I'll go every day. Every time you broadcast. Because kami apelin na request na county and now on. But I gave it to Tony yesterday. And I thought I go to Proclamate to City. And I sent it back on Tuesday to him. And he said, oh, okay, that's good. I'm going to do it for him now. But even with this kind of stuff, they can do it on Saturday, they can do it on Friday. They know that we always do both at Wednesday and Thursday. Welcome to the Voice of South Pacific. Today is the last day of the month, and it's all known, it's the Halloween Day, October 31st, 2024. So my name is Sylvia Taimi'aho. Thank you so much, Dr. Amy and also Lippy from the King County Public Health. Thank you for keep coming over and updates all great information that is most needed and necessary to our Pacific Islanders communities. And then also I have my co-host right here. Can you introduce yourself?
Saint Pulokatatola.
Saint Pulokatatola.
Hi, my name is Tessa Mafileo.
Tessa Mafileo is also an international student. Can you tell us just 1 minute, of your background?
Hi, so my name is Tessa Mafileo. Like she mentioned, I did my bachelor's back in Hawaii. I graduated with a bachelor in biomedical. And I'm currently pursuing my master's of nursing here in Washington. And it's nice to join you guys today.
Okay, that's wonderful. Before we continue on, I would like to meet with Dr. Amy and also Lippy and also the rest of those, that joining with us to introduce yourself. Dr. Amy, please introduce yourself and also the great topic that we're going to discuss today.
Awesome. So my name is Amy Xie, and I work at Public Health Seattle King County. And Libby and I are here to talk about the viruses that we get in the winter. So COVID and flu. So we're very happy that you invited us to be here.
Thank you. Lippy?
Hi, good afternoon, Sylvia and everyone. My name's Libby Page, and I work with Amy, and I'm the immunization program manager at Public Health Seattle King County. Happy to be here.
And then I also see Sina. Can you go ahead and introduce yourself and all of the those that going to our participants, to please introduce yourself before we continue on.
Hi, my name is Sina Packer. I'm representing the Tongan community, especially senior program. And it is very important for me to be here so I can find out a little bit how to improve our seniors' health when it comes to changing weather and flu season. Thank you.
Thank you. And now, Rosie. Hi, Rosie. Yeah, you're muted, Rosie.
Sorry about that. Bulavinak, everybody. My name is Rosie. I work at Pacific Islander Community Association of Washington. Here in Federal Way. She, her pronouns. Thank you for having me today.
Thank you. A lot of Fijian today. Hi, Lydia.
Bulavinaka, ma'am, Bulavinaka, everyone. Another Fijian here. Lydia is my name. Background with media the past long years, and now I'm in Federal Way, Seattle, Washington, and part of the community, especially in the media pushing issues using Facebook as our main medium. Thank you.
Thank you. And last but not least, I see Pastor Aseli. I know there was another Tongan pastor was supposed to join us, but Pastor Aseli, after you introduce yourself, lead us with a little short word of prayer before we continue on. Thank you, Pastor Aseli. Yeah, Pastor Aseli?
Yeah.
We can see you.
I'm here in Everett, also from Fiji in Bulavinaka, to the rest of the fellow islanders here, and also fellow community leaders, and grateful to be part of this, and hope we'll enjoy and get the best out of this program today. Let's pray. Heavenly Father, we come before you this afternoon just to give you thanks, bringing us together, Lord, to be informed with what we need to know, and also, Lord, the blessings of the day that you have given us to unite on this platform, and also to be informed with what is needed, especially in this time of our life for our people. We pray that you will lead us, direct us, and help us, Lord God, to be a conduit of your divine and also your empowering message to our people. We can be encouraged and also challenged in what we need to know, especially in this time of our life. We give you praise, we give you glory. Come lead us. In Jesus' name, amen.
Okay, thank you everyone. It's just like the topic that we're talking about today. It's about the Seattle King County Public Health and about the COVID. And so this is also a great opportunity to hear all the updates, and let us know what are the great information, necessary to dealing, and know about the standard and about the COVID. So first of all, I would like to give this opportunity. Saini, could you ask the first question, to Dr. Amy and also Libby Page. She is the one that does the immunization program for the Seattle and King County Public Health.
Yes, good afternoon to all of you and for the panel members, and thank you so much for the information you're about to share with us. But let me briefly just say a little bit of Tongan, in Tongan, so some of the listeners would appreciate the full extent of your assistance this afternoon. Hoek makainga mau kore ke mau hufanga whakatap ko topic wha oat me wharen, kai lava ke whakahokot e polokalama ko ia, o ku whakahokot me Seattle Public Health, ai au kia e tau toke tā whoken ko Dr. Amy, ka o maahano tokoni ko Libby, me King County Public Health, o na o mai ngai whakamatala, poko ngahi update whamui taha whikau aki koe ni pia mo ngahi tau mahaki koe ni o tau mahen ki ai, o hoko te momoko e koe flu. Lahi ko toa pe whakai flu kehe, ka aku konga lahi whaku iai o kei whai pe ngahi tokoni mo ngahi pōpō mo whare I whikau akpa mo COVID. Ain kone ni tau o si toa me ai, ka au tikai whuke osia, o kei hoko at pe ia, paka uhinga e polokalama koe ni, whia mao hi King County Public Health, ke tau tokanga o whenga ke whai whakaehi, ka uma a ngahi mea o ke lava pe ko whai api, o lava pe au whai api, ke tau whakahino pe ai tokanga nge pe ke mao mo uilelei, I he whakaehi koe ke o te mawhola atu, ai siemu koe o flu. Malo opita. So the first question here, it says, what are we seeing in terms of COVID and flu activity locally right now?
Thanks for that question. So we're entering into a winter season, as we can tell with the colder weather and the rain and the gray. So this is the time of year that we see more respiratory illnesses. And these are illnesses that spread when somebody gets sick and then breathes germs into the air, and then somebody else can breathe in the air and then also get the same germs and get the same illness. So what we saw was that this summer, we actually had higher levels of COVID when we weren't expecting that. So now actually we're better than the summer, but since we know that winter is a time where a lot of people can get sick, we want people to don't let their guards down and to be prepared.
Thank you. Thank you, Dr. Amy, for explaining that, and it's very clear. And before we continue on, I would like to ask everybody, all our participants here today, to please share out this information on your Facebook, and also let everybody know that it's also on YouTube. So it's on YouTube, on Voice of South Pacific, and also it's on Facebook. So, and all the social media, and also the Instagram. So it's very important, that it's reachable, and make everybody got the information.
So the next question, I'm going to give it to my co-host right here. Tessa, go ahead and ask a question, because I know that's your field of study. It's about, yes.
Thank you. The next question is, aside from flu and COVID, are there other illnesses we should be looking out for during this winter season?
Yes, there are. So there's COVID and flu, which a lot of people are familiar with. And then there's also two other diseases called RSV and pertussis. And this is usually known as whooping cough. So both of these illnesses can feel kind of like a cold.
Waiting, Tina, because of the important topic that we'll talk about. Date. So, but we will be back a few seconds, everything is all good to go? I hope everybody heard the next question. That was just, you just asked the next question aside from flu and COVID, eh? Mm-hmm. Yeah. Did you, can you ask it one more time? Oh, okay. Go ahead, Dr. Amy. You can repeat the question,
Okay.
Okay.
Oh, sorry.
Oh, okay. You got it? You still remember the question?
Yes, I do. Sorry, my screen was frozen for a little while.
Yeah.
So yes, there's two other illnesses. One is called RSV and one is called pertussis, also known as whooping cough. So both of these illnesses, they tend to make our babies and our young children and elderly adults sick, but for healthy adults, they tend to just feel like a normal cold. So RSV, luckily, we're not seeing a high number of cases this year, which is a really good thing. And then for whooping cough, unfortunately, we have seen the number of cases this year has equaled all 3 past years combined. So this is a particular bad year for whooping cough. The good thing about the whooping cough, though, is that we can prevent kids and babies from getting sick with a vaccine. And that vaccine is in a combination. So that would be the Tdap or the DTaP.
Oh, okay. Thank you. Okay. The next question, and then also feel free, even though we have some suggested question, but if you have any relevant questions, that you feel like you wanted to ask about the topic of the day, feel free to ask. That's why Dr. Amy and Libby Page are here, because they wanted to answer, about a lot of times the people are so curious, and then why is that? This is the time. We're so fortunate to have a King County Public Health that are supporting us, and wanted to spread the word, to our communities. Okay, the next question, I'm going to give it to Rosie. Rosie, this is the time you can ask a question, Rosie. Rosie is from Picowa.
I guess my question would be, what are the symptoms? And when are people more contagious? Like when the symptoms start showing or before the symptoms start showing?
Sure, excellent question. So we'll start with flu. So for flu, people tend to feel very fatigued, very tired first, and then they may get a headache. They can get some stuffy nose, and then also some fever. And the fever can be a low fever, like 99. It can also be high, like 104. And then one of the symptoms that sets it apart from the other ones is a lot of people complain about like body aches, like their muscles and their bones tend to hurt. So those are the symptoms of flu. And then your follow-up question is, when are people contagious with that? So the beginning of their illness tends to be the most contagious, but the people do start being contagious a little bit before they start getting those definite signs of sickness. Like people will definitely say that they're sick if they're home and they have a fever. But if you're at work and you're a little bit tired and it's a Monday or a Friday, that could be the start of your illness and you could still be contagious then. And then as the sickness gets put away by your body, as your body fights it, and then, a few days later, days 3, 5, 7, then it starts being less and less contagious to those around you. But it's super important that if you start feeling sick, to take care of yourself and to stay at home and try not to expose yourself to loved ones, to those at work as much as possible.
Thank you so much.
Okay, thank you. Now I'm going to give the next chance to Sina. Sina is working with the senior and elderly, and I think this is the time to get great information to share with the elderly. Sina Peka. Oh, Sina, please unmute.
Oh, I'm so sorry. Okay, being a volunteer at senior program, you get challenged question from them. Sometimes they only ask one question and then you have to figure out the rest. And one of the questions that one of our senior member asked, all I got is flu shot. That's all I need. I don't need to get COVID shot. How important that, what do I say to a group of seniors who believe that I just need COVID shot. I don't need flu shot. So can you explain the importance of having both flu shots and COVID shot each year?
Sure, I can take this question. Thanks, Sienna, for that question. We get that a lot too, questions that come to the health department about whether people should get just one shot or many. And I'm glad that Dr. Amy talked about all of the different types of illnesses that are circulating in the winter months, including the flu and COVID, RSV, and pertussis. And it's really important for older adults, the elders in our families, to get all of the vaccines that are recommended for them, because as we get older, our immune systems don't work as well as when we were younger. And so it's really important when you get vaccinated, you're teaching your immune system the memory of those illnesses so that it can, when it encounters it, it can make an immune response and protect you. So that's one of the reasons why it's important to get the latest COVID vaccine, even if you've been vaccinated before, or even if you've been sick with COVID before, because the newest vaccine that was just released in the late summer months and early fall, it's been really tweaked and tailored to fight against the variants of COVID that are circulating right now. So everyone who, even infants who are 6 months and older, but especially people who are older adults and people with compromised immune systems who have maybe some other conditions that would make them have a more serious kind of reaction to the COVID illness, a more serious illness, we really recommend that they get the current vaccine. We're very concerned that not enough people have gotten the most recent COVID vaccine. Only about 7% or so of people living in King County. So this is a great time to get the vaccine. And you can get it at the same time as the flu shot, so you don't have to make 2 trips to the doctor's office or pharmacy. So it's very convenient and safe to get both shots at the same time.
Thank you.
And Sina, to add on to all the good things that Libby shared, if you wanted to answer that with a little bit of a scarier answer, you can say that COVID is still deadlier than the flu. That's what the pattern that we've observed last year, and I think will still continue to be true this year based on the patterns.
Thank you.
Locations.
And then also the location too.
People can get their shots.
Like where people
You
can
can
get
always ask.
vaccinated.
You can. Yeah.
Yeah, so most pharmacies and doctors' offices have all the vaccines that are recommended. And you can also find vaccine events, especially in South King County. And for people who don't have insurance or have a Medicaid, there's no cost vaccine at a lot of the community health centers like Health Point and CMAR and International Community Health Services, and as well as community vaccine events that we're hosting and the State Department of Health is hosting. And those are all listed on our website at kingcounty.gov/find-a-clinic. And that's where we list upcoming events that are open to the community. And again, that's all no cost vaccine for patients. There's no billing.
Okay.
Can you repeat that one more time?
Yes, it's
King County?
kingcounty.gov/find-a-clinic. And we
Find a
have a
clinic.
calendar of upcoming events.
Okay. Thank you.
You're welcome.
We put it on the screen so that the people, the audience, and everybody can get access to that information. Thank you.
Oh, I just remembered another thing I wanted to make sure to mention is that we also have a mobile unit that visits people who have difficulty leaving their homes. And so you can email us at vaccineinfo@kingcounty.gov if you have a family member or loved one who isn't able to go to a clinic or pharmacy to get vaccinated, and we can actually come to their home to provide the vaccines. Again, this is free at no cost.
So I have a quick question. Thank you for giving out the information. For us who volunteer like senior programs once a week, and if we have a sheet of sign up more than, I would say 10 or 20, and you'll be able to come out and do those on that day that we request?
Yeah, usually we need a week or 2 notice just to work to make sure that we can fit it into our schedule. But we can almost always, yes, accommodate those.
Oh, that would be great.
Okay, thank you. Now we have Lydia. Lydia?
Thank you, ma'am.
Was a former broadcaster from the islands of Fiji.
I have a question for Ms. Page. You've mentioned the latest COVID vaccine. What is the actual name of that vaccine?
Oh, that's a good question. Well, so there's the manufacturers are Pfizer and Moderna. They make the 2 mRNA vaccines. It's Comirnaty and Dr. Amy, do you remember the name of this? I should know it, but I can't think of the name of the other vaccine, the brand name. I'll have to look it up and get back to you, Lydia.
Spikevax.
And
oh, that's it. Yes, Spikevax. And then there's also a vaccine that's the more kind of traditional egg-based vaccine, like the flu vaccine, that's called Novavax.
Novavax.
And the volume of the content that needs to be injected
Is it less or more than the actual amount that we take in the previous vaccines?
Oh, it's the same dosage as the
Same dose.
last.
And also question for Ma'am Emmy. Back to the answers that you gave, there are two types of infections or illnesses that we have to watch out for during cold season. One you mentioned is the whooping cough, which is the pertussis. The other one is RSV. What is the long form of that?
That is respiratory syncytial virus. So respiratory, like breathing.
Yeah.
And then the S is SYNCYTIAL virus. And it's a virus that causes children to have trouble with breathing because that children have such small windpipes. Their lungs are smaller than adults, so some of their breathing areas, unfortunately, are about as thin as straws. So when the virus really likes those surfaces that the kids use to breathe, but unfortunately they can't really get any thinner, and so people have observed that it causes the kids to make a whoop sound when they try very hard to breathe. So that's all to say that it's a virus that mostly makes kids very sick. And it's one of the viruses that tends to be circulating in the winter when we're thinking about everything else that makes you stuffy and cough and whatnot.
So it's been there for ages, or has it been diagnosed recently?
It has been there for ages, and it tends to come up seasonally.
Yep. Thank you, ma'am.
Oh, Sally?
Just the sum up of what I've heard. When we understand COVID and other illnesses connecting to cold, we can sum up that it's the cold and the lungs. Cold and the lungs. That lungs, if it's infected, causes cough and all that. Just a bigger picture for us to, you know what I mean?
So cold kind of doesn't really specify what is causing it. So we kind of just think of it as, runny nose, cough, feeling tired, maybe some headache or some fever. So there's actually a lot of viruses that can cause cold symptoms. So that may be what you're talking about, is we're kind of dividing it up into, the scientific term for what the germ is that's causing the cold. But the cold is the illness that a lot of people will experience from it.
Thank you so much. Thank you.
Yeah.
Now, we'll switch over the clock to Pastor Aseli. Pastor Aseli, also from the islands of Fiji. Today is the Fiji Day, too.
Just a quick question on, we are in a festive season right now. So what are your recommendations, especially that will help us to prevent someone or family member or community member from getting affected by this either flu or whatever vaccine, sickness that's coming out during winter now?
Yeah, that's a really good question. I knew about Thanksgiving and Christmas, but the Fiji Day is a new celebration that I'm learning about today. So thank you for sharing that. So yeah, you're so right that the elderly members, the oldest and the youngest, are ones that we need to protect in our community. And so these are, if you know that you're going to see a lot of family in this time of year, I would recommend timing your vaccines about probably 2 weeks or more before doing all of the festivities and seeing, the whole family to maximize how much protection you're going to get from the vaccine. Now, of course, this applies to children and adults who are healthy, but when you're actually in that space and, in the party area, maybe with them, it's good to pay attention to airflow. So a lot of times when it's cold, we don't like to have all the windows open, but to know that, having air filters or purifiers is a good practice. And then having, even if it's not, air conditioning or heating, just having air flowing in and then out of a room, then that can help with having the germs just sticking in the air in case somebody is just beginning to feel sick and they don't realize it and they breathe out and the germs are in the air. And another thing is to wear masks that fit well on the face when you're near a crowd of people, especially when the crowd of people has people in it that are more vulnerable to getting a severe sickness. So those, the babies and the older adults. And then in terms of protecting yourself, it's good to have a healthy lifestyle so that your immune system can be fully ready to be fighting against whatever it is in the air that you happen to breathe in. So this is your doctor probably already talks your ear off about these things, but healthy food, exercise, and plenty of rest as well. Those are things that help your body to be able to handle these things within a shorter amount of time than like a long illness.
Thank you. Thank you, ma'am.
Yeah. And of course, if you're feeling sick already, don't go. I think that now we have a lot of technology, so it may be safer and you can still feel part of the fun, right? By calling in and then saying hi to everybody and then saying, I'll spare you, the COVID or the flu or the RSV, whatever it is that I happen to have. So it'll be a virtual hug.
Ma'am, I have one last. Sorry, are you done, Taltala?
Yeah, I think the temptation, just to add on to that, just the temptation of being part of that, since it's a festive season, I want to feel everything around. I think what you've told us is very important as far as what we need to know just to help us and help our family members from getting in to this. So, yeah, thank you. Thank you for the info.
Yeah, when I feel like I'm missing out on things, it always helps me when my family and my mom like prepares a food plate for me and then maybe drops it off. So that way I can kind of feel like I'm partaking in some of the celebrations in a safe way. So that's something to consider to do if the sick person is, your friend or your family member, to make them feel a little bit included and less bad about missing out. Yeah.
Thank you. Thank you for the info.
Thank you, Dr. Amy. It's just like a little quick thing to when I heard while you were talking. So you said that even though if it's cold weather or hot, is it nice to have the window a little bit, to maybe have some fresh air coming from outside? I just want to be, clear on that.
Yeah, fresh air I think is always a good idea. Maybe except for wildfire season, that may be the exception. But the air from the outside tends to have a little bit more oxygen in it because the plants are able to do the things that plants do. And then also if there are any germs in the air, it is much more spread out outdoors than indoors.
Thank you so much. That remind me about like 40-some years ago when I first arrived in the country. I was like a care provider to an older lady. She lived up to 102 years old. She turned her heat on during the winter season, and she still leave her window open. But now that's absolutely right, and I started to practice that too. Even though you turn the heat on, but at least you get some air, the actual fresh air, coming from outside too. And get some dust air from your room. You don't even see it, but it's maybe a lot of dust, Thank you so much,
Just have a quick question too. Do you know, a lot of the people always wonder what's the status of the COVID, nowadays, because since 2020, now we're going on a 4th year now. Is it still needed to get vaccinated and to get tested, for the COVID? Because, there were some people that didn't want to do a vaccine, but anyway, it just, it's just a question, is it still needed,
Yes, we very much encourage vaccination with the COVID vaccine because it has shown that it will reduce the likelihood that you would get sick, and if you get sick, that it will likely be less severe. So more likely is having some sickness, some sniffles at home than having pneumonia in the hospital. And another thing that has come to our attention is that a lot of people are experiencing long COVID. I'm not sure if people have heard about this term, but used to describe a variety of health problems that happen after getting sick with COVID. And some of them can be very debilitating and affect quality of life, but there's not really a cure for that. So what we know is that 10% of the people who get sick with COVID develop long COVID. So even if you say, oh, I'm tough, I'm not scared of getting sick from COVID, those long-term effects are definitely something to think about. And if you don't protect yourself from getting the sickness to begin with, there's not really a separate way just to target the long COVID aspect. So those are things to definitely think about. As far as getting tested, it is, I think, good to just know what you have. There's at-home test kits that you can get for free from covidtests.gov. I think gives each household 4 tests for free, and they just mail it to you. So you can do that at home to know what you have. And the important thing there is that if you do test positive, you can let your doctor know that you have COVID and ask them if you are a candidate to get a COVID treatment. So the treatment that's available is called Paxlovid, and the doctor will consider your medical history, your medicines, and then your risk for getting severe COVID. But I'll just say that age 50 and above is a category where thinking about Paxlovid is recommended. So it could, if you test positive, if you know you're sick, it could be a way to get that medicine and then make your sickness shorter and less severe.
Okay, thank you, Dr. Amy. Now, looks like we finished, the first round. I know, Lydia, you'll be next, to ask the next question, but I'm gonna ask the radio engineer, please, can you play the tussle, just for 10 seconds, while we're switching, Also, it's very important that you can comprehend all this great information and share it, in your native language, to your community. And also share the program. Please share it, to all your friends on social media and let them know that we're also on YouTube. They can sit at home and watch it on their TV. Yeah, right now it's 15 minutes after 2, so we only got 15 more minutes. And I'm going to ask Lydia. Lydia, I know you have a question, but you can go ahead and ask that question that you put out.
Thank you, ma'am. Just a question that just popped up compared to the previous time. when COVID first hit, and nowadays, what are the percentage of people dying from COVID?
Libby, do you remember the numbers off the top of your head?
I don't have the percentages, but I know that like in the 2022 when things were really, very we had much more COVID circulating, we would see around anywhere from 50 to over 80 deaths a month. And now we're down to more like 10 to 18 deaths per month. So it's gone down, but still, of course, every death is tragic and preventable.
People are still dying, right?
Mm-hmm. Yeah. I mean, if you think about 10 to almost 20 deaths per month, and mostly in the elderly.
Okay, babies and elderly, they are at risks. What about people who have TB when the lungs are already infected? Are they also a big risk to getting COVID?
I'm looking at Dr. Amy.
Yes. So risk for COVID depends on so many different things. So having tuberculosis is one of the things that makes your body already have its attention on fighting something. So adding COVID on top of anything else that the body is always day-to-day dealing with makes that person at higher risk of getting a more severe form of disease. For tuberculosis, I would think especially a pneumonia would be of a top concern of mine because tuberculosis can create scars in the lungs and create holes in the lungs where the lungs have been damaged already by tuberculosis. So I think that if you had COVID on top of the tuberculosis, that person's making sure that they're breathing okay and getting enough oxygen would be something to ask about frequently if this is a loved one of yours.
Thank you, ma'am.
Just to follow up, ma'am, just a quick question. Sorry, Sylvia. What are we doing different compared to, the last time that reduced the number of COVID deaths? What are the community or what is the health doing that we are doing differently that is resulted in the less death?
Do you remember in 2020 and 2021, we didn't have a vaccine back then. So there was no way, we didn't know really how the virus behaved entirely at that time. So we were all scared. And then if we got it, it feels like it was just inevitable that you would just get sick. And then the sickness sometimes was very severe. And so that was a very different time than it is now, when we have some understanding of the virus now. We know how it's transmitted, what is more effective, the air, the spreading through the air and through particles or from droplets, germs in the air. So that's a thing that we learned. And then also the scientists have been able to make the vaccine, and not only make just one vaccine, but they're customizing the vaccine every year, which is why Libby was encouraging everyone to be updated on the latest version, which you can see is 2024 to 25. So there's a variety of brands, but essentially there's one that's specifically made for this upcoming cycle. And actually the scientists look at the way the virus is changing with time, and then they predict what is the next thing, and then they make that vaccine specifically for that. So I think it's really cool as a person, in the science part, to see that sort of tailoring to it. So for people who say, I got it once in the past, I don't need any more, I think they're missing out because it's a customized on one. And I think from the early data that we have for this year, I think the match that the vaccine covers and what is, being spread around in the community, I think the match is a pretty good one this year.
Mm-hmm. Yeah, I recall just I think a couple of months ago, they will see that there were rise again in COVID, the cases, So I think it's something that we just need to know. We still have a part to play. So, it's not just to be careful with how we do things and how we live lives. So, with an ongoing research that the scientists are bringing to the table and all this customized, vaccine that are available, that will help us as a community to move forward and also to help.
Yeah. So COVID, I think we wish that COVID was just a winter problem, in the same way that, flu can be more predictable every year. It does similar things. But COVID has shown itself to be a year-round virus, and it keeps changing. And so it's kind of tricky in that way, and that every time, we have developed some kind of protection maybe against it, unless people are getting sick, the virus changes itself a little bit so that the immune system no longer recognizes it as, oh, like this is, maybe what I've had before, and that I can protect myself against in the future. So it's been very tricky to work with, but always changing. That's the kind of constant throughout the many years, is that, all the different variants, I think we can all name what Delta,
Okay.
Omicron, previously these words didn't mean anything to us, but now we think of them as major variants that are in the community. So the variants keep changing, but sometimes there's a name that the general public knows it as, and other times it's just numbers and letters with periods in between, and the scientists and the public health officials are tracking it. So I think the difference is that it's always changing. So this year's is different than last year's, but I think big picture wise, it's just keep being vigilant and protecting air health, and know that as if there is an update, that is the best thing, the new best thing.
Yeah. Thank you, Joe.
Okay. Well, it looks like, we're getting close with the time here. So don't forget, at the end, we'd like, to say something, like in your language, before our closing program. But at this time, I'll give the opportunity. Go ahead, Tessa.
My question is heavily focused on the vaccine. So we've discussed the availabilities, the diseases that we're facing during this winter season. But I know if people have COVID-19 and also flu, they usually run for vaccine. But during this winter conditions, does it impact the COVID testing and also the vaccinations? And what is the onset when people get flu shots or also COVID-19 shot? Can you elaborate on that part?
Dr. Amy, do you want to take that, or would you like?
You can go for it. I feel like I've been talking a lot.
Let me know if I'm not answering your question, Tessa. So for COVID, a lot of people, like Dr. Amy was saying, we had a bit of a wave of COVID illness in the summertime. And so people like me got COVID in the late summertime with a lot of other people. And you have some immunity from that illness, and you can actually wait about 3 months until you get this newest COVID vaccine. And that's what I'm planning to do. So I got COVID in late August, and I'll be getting the this newest COVID vaccine in late November, about 3 months after my illness. And then after that, after you get vaccinated, it takes about 2 weeks. And this is the same for the flu shot and other vaccines typically is, it takes about 2 weeks for your body to build up, to respond to the vaccine and build up the immunity to be fully protected. And so that's why we're recommending that this is a really great time. And we actually kind of have a thing about get vaccinated around Halloween. So this is the perfect day to say this. This is a really good time to get all of your vaccines for the winter season. And that means you'll be protected before a lot of the family gatherings around the holidays. Does that answer your question? Or one of your questions.
Thank you so much. So you're saying 2 weeks is the onset when you get
That's when you're fully protected. Yeah.
Okay. All right. You did answer my question.
Okay.
Thank you.
Thank you so much. Yeah, Saini, go ahead.
Yes, thank you. I would go ahead and do translation to Tongan so that the listeners who would benefit more from having it in our own language. Io, hange koe mo os mea mai ki ai ak mo tolu ka whanongo. Koe Popo whakene mo whahinohino me he potngau mo ui koia a King County Public Health. O whekau aki pia mo e te whakatokanga ange pe ke tau te tokanga ange. Hange pe whakoia mo os mea i. Koe lahi taha taimi puke, puke taimi koe flu. O hoko ia i he taimi momoko. Ai whako taimi ni hako siero koe ni he taimi ni. O moko ange whake ea. Aia o ku lahi ange ai uha pia mo lahi ange ai ea moko. Ai ko whakamanatu mai he toke tā koe ni a Dr. Amy ka pehe ki hono toko ni. Ke tau toi tokanga nge pehe ki whakaehi me he mau koia o ke tau mokosia pe koe whakatupa me ke whahe tae. Ko lahi taha pe whake ngahi siemu koia o ku whanonga holo he wa taimi momoko koe ni. Me a whekau aki pia moe ngahi puke, whekau aki pia moe mānawa. Ai whako ea halanga mānawa. O ku wawe ene mau koia ai mahaki peko ngai siemu koe ni ke whae me ai. Nai pehe whake e tā kusai au pito pēka pau e haki taimi pungai miniti ke whakaawa e koia ho matapā pe ko matapā seo ata. Neongo pe ulere ho hita pe o mooni pe ia momoko. Kai ki whakaawa ke hau haki ea lerei ea fo o mei tua ko hike ne hanga o teke i atu ai. Ngai siemu whoke nofo pe i loto whare. Pe koe siemu pe me he fu. Ko hike tukuanga tiki tua kai humaha ki ea lerei ke lava whakafo o aki ai ea koia i ho whare. Whakamanat mai whoki e tokoni au pito pe ha o mao mea tokoni whiunga mo lerei mo ui lerei. Hangi koe ko mautou mo wha mea mai ke polokalama koia mo toke tā kaufusi. Ai whakamanatu atu ke mau e mea tokoni lelei. Ai hanko ngahi vitamini, ko ngahi fresh food. Ai koe ko mau mai. Ko hi he tokoni lelei au pito ia ki he whakamalohi ho sino. Ke ne hangao teke i atu ai puke tau i ngai mahaki. Pea whamanat mai whoki kātaki, neongo ka paone ke osi huhu ko ia e he wanoa, puko i he ngai tau e ua kon ko osi, ka ke manatu i o whakafo o e whaito o, ke whikao ke ngāwe lerei ki hono teke i pi hono tau i ko ia, a siemu ko ia COVID-19, he manatu i whok o whiriuri waki pe ia. Ko ia lava atu rewa ke ofisa o toke tā, pe koe pe ngai wheitu u whai huhu, po ngai huhu koe ni o kai ke totongi. Aia koe hare hano mau ka koe ke mau ho mo irerei pe kai ngata pe kia te koe, tau whitu whoke whanau i ki ange, pe mo tau kau taure ke reka, koe kau vai. Malo au pito.
Okay, thank you. Yeah, sorry for taking that in a Tongan language, but but the thing is, it's also very important, for us to share, interpret that, in our native language. So before we finish, because those Dr. Amy and also Lippy Page, we finish up that time. We only got 1 more minute, but it's up to you. We're gonna still be here, and then because we have the Fijians, also they have to translate that in their language. Dr. Amy and also Lippy, just whatever you think, what is the most relevant thing at this time, as we discuss about the COVID-19? What is something that you could really advise us, to kind of go by that, to keep ourselves safe? We live in a safety measure environment.
I think the most important takeaway here is that as we're entering into winter, there's a lot of sicknesses that people can get from each other. And the best way to protect yourself and your community is to get vaccinated and stay healthy. So I hope everyone is able to stay healthy and have healthy families and happy celebrations of Fiji Day.
Thank you so much. Lippy, do you have anything else to share
I think
about the
Dr. Amy
vaccines?
said it perfectly. And just a reminder, you can always contact me and our immunization program if you have questions about where to get vaccinated, the events that we're holding for communities, especially living in South King County, and also our in-home vaccination program. Thank you so much for having us.
Thank you, Lippy. Thank you, Dr. Amy and Lippy. As we're coming to the close of our program, you feel free, to leave that because it's 2:31 right now. It's in 1 hour now. But if you still want to be in, I'm leaving the opportunity to the Fijian representative to share something in their native language about the COVID-19 update. So
Awesome.
maybe
Thank
either
you so
Lydia
much
or
for
also
having us. Yes.
Thank you, Dr. Amy. Thank you, Lippy, for the wonderful sharing of this great information that is very, very relevant to all of us. Malo, that's our native word.
Malo.
Okay, and who else is in there? Pastor Aseri or Lydia or Rosie, can you share something like or Lydia is still in there? Can you share something in the Fijian? Who's gonna go first?
Ma'am, Talatala will do on our behalf. Thank you.
Please, Lydia, I'm gonna get going. I have another engagement, please.
Okay, thank you, Pastor Aseri. Okay, Lydia.
Nakataltala nimbola vinakana loeviti nanda babande babiti ngandremena bunudi ani weekend na vukni matingwa COVID-19 sakavida batamani ambaki ndakilana nondra bakalengaye vida na wekanda voleka na matingo enangauna ya bini wekanda era takali yana kena sangay mela lora ina kena ni mate na idula virna kena ndoni bakandindike sati bulutu pamalu kena na wili nangonongo selanga tinga rauta tiko ni tinika 5 kina tinika 8 na leo ni benua ena lo manindo na bula era bakalenga yana COVID ndi na manda ni 1 na wain mate sa sambai ngara ni ndatakaba menda marro kina kira nda kalmani nda dula ne dula baru taki dula bobo era raida rauna ndoni bandindike kira na buku menda dula kina menda tangu mai anda buku ni COVID tiwa tangana idula ni flu esa ramba ile butu na nonda kila na itu kuni bano menda la kina kapkasianga itiko sana bono menda pakata tarukina na website sartungori raw menda na pakati dikani kina ndalako talaidula lebu tangana mate la tu mengo bita kabi mate taka pambibita kitiko birna lubenda lalai kira nangasi irna matua raw ni ratobi mate baleta na kena raw ni ndia wana mate ngo sanita kini oni na sema mai rongoda na tuku bonde otaki na tanga di bebango kanda taka kenda kina meda koti kenda mendala itula binaka bakatlebu. Thank you, ma'am.
Thank you so much, Lydia, for all this great input. Okay, last but not least, Tessa, what is something that you wanted to share for the closing of this COVID-19 update?
An important intake that I've learned from this session is the importance of getting your flu shot, also your COVID-19 shot updated. Although we've had shots back in, because I'm guilty as well, so I believe that is one important thing.
Thank you so much. Well, we're thankful to know that we're getting close, to the end of the program, and as we're about to finish up, the closing of this great program about the COVID-19 update, please keep sharing that, Thank you, Lydia, for representing the Fijian community, Pastor Aseri, and also Rosie. Keep sharing it, and you can share it in your native language. I'll ask, like another one, Tosa Mai, as we're closing up this great program. Malo Alpito, going to go osituka pe sing kuloka, ana famatala ifratonga, and I met go firmau. Tau te fitu wanga sei ni ko ne pe ko
Te ma pe ka pau ki whakawha si pe window he, futai momoko. Kai ke pere whamoi ho hita. Ma te whawai hita te me taha ko whonu he fu mo me au hawai e ai o tau mana wa. Ka whe ma o whaketau ngau e fresh air. Pea mo ngahi me a kai mo uilelei. Ke tau koni ki hono pa mo uilelei. Koe a koa he. Koe upcoming tata e ni i he feature Koe 3 o'clock. Koe hokata tonu koe ai tolu. Maha koe osi mni te honga full me tolu. Whai le vai tau prokalama the upcoming election. Pea koe hale about how important it is to go and vote, cast your ballot, and then also it's very important to know mau inga o pito e tau ilo. Ko hai e toko tahate ne whawhawhonga i lelei ki tau tolu e hoko atu. Pea koe hoko tonu koe nima, hu mare vai a toi tāpakeri. Havili kau fusi, pe ate pe whoki heni. Pea mo ngahi whanongonongo ko ia, pe kau aki ko ia mo ngahi mea whaka eiki o tō tonu o tau koloni. Ko e tā e pene tau ki whaiwhasi, pa te tau ki i lepasi e, os ko ia pa te tau toki hoko atu i he osi hongo fulu ko ia me tolu. Malo.